Welcome back. The time is 7:20, and we are joined this morning by Harrington with Maison V to discuss anxiety. So first, thank you for joining us this morning.
Thank you for having me. I'm so excited.
Oh, as am I. Let's just dive right into it. What exactly is anxiety?
So anxiety, when it's normal, is our mind's way of saying, send oxygen to the body so that we can think clearer and react to a situation and solve it. That's when it's at its normal level. So it shows up just like today, like showing up for TV and being on national live TV, right? Pretty simple.
And so, I was talking to you in the break and said how I experienced my first panic attack a couple years ago, which there is a difference. So when it comes to anxiety, what are things people can look for to kind of give them that inclination that they may have anxiety, that they could be having an anxiety attack and things of that nature?
So there are 5 telltale signs that tell us anxiety is kicking in, right? So think of the word want. So W for consistent or frequent worry. And then anticipating danger often is another one. And then that you expect negative outcomes pretty regularly. And the fourth is that I get tense in situations that I shouldn't be getting tense in. And then finally, the telltale sign for anxiety that gets distressful is I start having what if thinking. What if this and what if that, and they're worry thoughts. Now, if these things are happening for more than 6 months, then we're at a level where we want to consider medical care.
Is there ways, because like myself, before I realized I had anxiety, certain things I just brushed it off as like, it's just a part of life, it's things you deal with. Then I had the panic attack, and then I realized I do have anxiety. Like I'm always worried about the future and always needing things to be a certain way. So when it comes to those small things, how can people kind of dial in and realize that I shouldn't maybe brush this off? Because like you said, 6 months down the line, it can get a lot worse.
Right. So we have 3 treatment areas that really help. In the early stages, things like complementary alternative medicine practices really help to resolve the neurological events that are happening. There's an array of categories in that area to address, right? So things like massage or addressing how much caffeine you're taking, and there's some simple ways to look at that. Then we also have, of course, seeing a physician, having a conversation about medication, if it's appropriate for me or not. And then there's also asking about whether I should see a professional mental health provider, a therapist for individual or family counseling, couples, those sorts of things. So each combination is different for different folks.
Okay, Susan, thank you. And you want to stay right with us because after this break, we're going to continue our discussion about anxiety.
Thank you.
Welcome back. We are still joined by Suzanne Harrington to discuss anxiety. So, Suzanne, let's go a little bit more into the specifics of anxiety. We were just talking during the break. When I had my panic attack, it was tightness in my chest. I was hyperventilating. I had this feeling that I was essentially going to die before doctors told me it was a panic attack.
Yeah.
So when it comes to anxiety, what are some of the more specific things people can kind of dial in on to determine that?
What you did in that situation, right? When we have that tightness in our chest, whether it's panic attack or it's a heart attack, whether we have that history or not, going to the emergency room is the appropriate response. Yes, it's a very fear, like the fear just gets so intense, we start to think about dying. The Google search activity that we want to do in those situations, that doesn't help. Typically, how it's set up is the most intense situation, right? It does those pieces. And so it's important to look for sweaty palms, pounding in your head, different things that change that, right? So, for example, when women are having a heart attack, there's digestive discomfort. When men are having a heart attack, that's not there. When both men or women are having a heart attack, there's left arm pain that's shooting out. So those things are more heart attack associated versus panic attack, right? So anxiety might also show up with our heart rate picking up as well, but it's not chest pain. There's a difference there.
Okay, and you're speaking of whenever I Google, like I said, I Googled chest tightness, and the first thing that popped up was heart attack. That only amplified my panic attack. So, and you spoke in the first segment about us. We work on TV. Just different things can trigger anxiety. Are there things people can do? Say someone's about to present in front of a class or make a speech, a presentation at work, that they feel those jitters start to ramp up. That they can do to kind of calm themselves back down.
Absolutely. So I'm not used to being on TV every day like y'all are, right? So I have to do those sorts of things to make sure I center myself, right? So there's diaphragmatic breathing. There's some things that you learn to connect all your chakras that are all part of the complementary alternative medicine practices to assist.
And thank you for joining us this morning, Suzanne. We will have more information on anxiety on our website, but Adam, what do you have in the weather world?